Today we're going to be talking to Dr. Morné, the vet of Cottage Vet, about something that you may have heard of but never understood: Cruciate disease. Dr. Morné, what exactly is Cruciate disease and which animals does it affect?
That's a very good question, Tony. And Cruciate disease has been shown now to be one of the most common reasons why dogs are limping on the back legs. And basically, I've got a little model, so I just quickly want to explain what happens. Is if we look at the normal knee, you would find that we have the tibia, which is below the knee, we have the femur that's above the knee, and the cruciate ligament is a little ligament that sits inside the knee. So if we go all the way inside, the cruciate ligament sits over there. And its function is basically to stop the tibia from moving forward when the dog takes weight on the leg. So normally when they start standing, this bone here wants to move forward and the cruciate stops that from happening. So it stabilizes the knee when they stand. So it's very important structure in the knee, and as soon as that support is not there anymore, every time that they stand, these two bones want to move apart from each other like this. And that's why, and the reason why they start limping.
Is that a painful condition?
The first few days can be, because we've suddenly got a lot of swelling and in the joint, and we've suddenly got the joint being quite tender because the ligament has just snapped. But we do know that after a few days, it actually isn't that painful, although the limping can be quite pronounced. We can have dogs that don't put the leg down on the floor at all. And so it's not that painful after about a week or so.
Why does it snap in the first place?
So that's also a very good question. The more we know and learn about cruciates, the more we understand that it's actually a very slow process. The actual traumatic snap, so a doggy that stands weirdly and it just literally snaps, that's actually quite rare. Most dogs actually have that the ligament starts degenerating, so it gets weaker and weaker over time. And in some dogs it can happen from the age of 6 months old. And as the ligament gets weaker and weaker, we would find that it starts to almost unravel. Literally, if you look at it, it looks like a ski rope that you've taken a really blunt sword to it. So it literally is just little fibers that are frayed. Now, something, of course, causes that last little bit of fibers to actually snap or break. And that's often when you suddenly see the dramatic limping that starts.
Are there certain breeds that are more susceptible to cruciate than others?
So we see it in basically all breeds, but we do know that some of our large breed dogs, so specifically Labradors, Golden Retrievers, we see them very, very commonly. Of the small breeds, we see it quite often in Yorkies, we see it quite often in Jack Russells. So often our very active breeds, but we think there's quite a genetic component to it, potentially when it comes to our Labradors and our German Shepherds sometimes as well.
If I notice that my dog is limping, do I ignore it for a couple of days? Do I immediately assume the worst? Do I rush off to my vet? I mean, what is the protocol for cruciate? How do I know whether the dog has cruciate issues?
So as I mentioned, that this is one of the most common reasons these days that we do find dogs limping on the back leg specifically. But I think what's important to realize, it's not the only reason. We still have a lot of other reasons. It could be just an injury, and they stepped a bit funny and they hurt a muscle, they've got a slight strain or a sprain of one of the other joints. Those things are still possible. So I think it's not necessary to think automatically that my dog has a cruciate that's torn. But I do think that if a dog isn't walking on his leg, normally it does require some sort of a vet visit so that we can see what the problem is. This is diagnosed by actually a physical examination that gives us about 90% of surety that the cruciate is gone. Now and then we might have to take some x-rays if necessary, but it really is literally looking whether this bone can move relative to the top one. So if the tibia can move, it shouldn't be able to move. So if it can, that's diagnostic for cruciate disease.
Right, so I come in to see the vet and the vet says to me, your dog has cruciate disease. What's next? What is the treatment?
Okay, so generally speaking, there's either conservative treatment, which we talk about, so not operating, or there is surgical treatment options. So generally speaking, in my opinion, some surgery is better than nothing, because if we just let nature take its course, we get a lot of arthritis that forms in the joint. And dogs can take up to 6 months before they start using the leg adequately again. During that time, of course, we get a lot of muscle wastage. There's a lot more strain on the other leg. The other cruciate ligament can actually get weaker again. The other hip can get sore. Lower back pain can come into play. So there's quite a lot of things that can happen during that recovery process. So if we have a cruciate ligament that's completely torn, we really actually do advise surgical intervention. Now, if we look at the surgeries available, there's also quite a list of surgeries that can be done. But mostly, the two most common surgeries, the one is actually putting a nylon band around the joint. And in that way, it literally tries to mimic the natural ligament and just stops the backward forward movement. It sounds very great and it sounds very simple. And it does work in a lot of dogs, but there are some dogs, particularly our big dogs, our very large dogs, our heavy dogs, and our very active dogs, where it doesn't work as well. In those dogs, we sort of look at the more advanced ways of treating it. So looking at actually how the knee works. And instead of just putting a band in it to try and stop it from moving, we rather change some of the forces in the knee. Now, this is very fancy maths that we don't really have to worry about too much. But at the end of the day, there are procedures where we can change the actual mechanics, and in that way, we don't need the cruciate ligament anymore. It becomes completely unnecessary. And we can do that by various ways. There are cuts that's made to the front of the bone, and this is moved forward. There are cuts that are made like around here, and we don't need to worry about all the details. But the important thing is those more advanced surgeries are really advised for our bigger, more active patients. They've got an excellent chance of returning to full function. We've got dogs that go back to agility, to slaying, to jumping, to doing whatever they want. And it definitely is advised that some surgery is better than nothing.
If they've undergone surgery, whichever surgical procedure you opt for as a vet, what are the chances of this reoccurring?
Okay, so because the cruciate ligament was completely snapped and has now been fixed, especially with the more advanced procedures, that cruciate ligament is not necessary anymore, so it can't happen again. It's not something that we can go back and say, oh, the cruciate ruptured again, because the cruciate is not necessary, we don't need it to heal. The other technique where we use the nylon band, that unfortunately can snap. And then we can have a chance that the instability, the movement in the knee returns. And in those cases, sometimes we do have to redo the surgery or start surgery again from scratch.
What happens if we just ignore it? I mean, we know that animals don't show pain easily, that they are fairly subtle when it comes to displaying signs of pain. What if we just ignored it?
Okay, so the good news with cruciate disease is normally if it's torn, you can't miss it from an owner point of view, because the limping is quite dramatic, especially in the beginning. And no, they're not going to show a lot of pain, but they're going to show a lot of limping. They're not going to want to use the leg much. But as we ignore it, we're going to find a lot of arthritis developing. Arthritis to the point that in 4, 5, 6 years, it's going to cause a lot of pain, a lot of discomfort, and can actually impact their quality of life quite a lot.
Is there a way to avoid cruciate disease? I mean, if I have a puppy, I've taken a new puppy. Let's take a large dog, a Great Dane, as a puppy. What can I do from puppyhood to adulthood to try and avoid something like this?
Okay, so sometimes you can do the best you can, but you will still get a cruciate rupture, and that's unfortunately got to do with the genetics. It's got to do with this weakening of the ligament that we have no control over. But we know there are things that make the likelihood of it snapping more. And that's where we look at weight is the first thing. So controlling a dog's weight, stopping them from getting overweight is so important. They can of course continue with activity. Activity hasn't been shown to make a huge difference, although an overweight dog should now also not go and jump down 4 flights of stairs every day. That can also just put too much strain on the ligament. And then lastly, feeding a good quality food while they're puppies. Your large breed dogs need to be fed a large breed puppy food. It helps the joint development, it helps them to grow better, and in that way we are really trying to guard against any joint and ligament problems in the long run.
Thank you very much, Dr. De Vet. That was really useful.